Okay, we just went over hyperglycemia. That's before someone gets diagnosed. Um, they may have the symptoms of hyperglycemia, polyuria, having to go to the bathroom a lot, polydipsia, very thirsty, and hunger. And or if they're not taking care of their blood, like not getting on medicine if they have diabetes. However, one of the more severe the side effects could be once somebody is getting treated with medicines, like oral medicines to help the insulin that the body does have, or injections with insulin, is hypoglycemia. So the way the body works, if it doesn't have diabetes, you eat something and then your pancreas releases insulin, right? How much it needs. Well, when you give someone an insulin injection in the morning or take medicine, the doctors are trying to figure out, okay, if you eat this much, then this is the amount of insulin you have. Well, we don't always eat the same amount every day. Exercise will decrease the need for insulin. We don't exercise the same every day. Stress will change your needs for insulin. We get stressed out or getting sick will change the needs of insulin. So it's not an easy thing to do to stay in control. So hypoglycemia could happen, and that's low blood sugar, and it happens pretty quick, like fast. So the reason for it with someone who has diabetes is that there's too much insulin for the amount of carbohydrates eaten. Okay, and like I said, every day we eat different. So reasons you don't eat enough food, you're not hungry, or you take too much insulin or the diabetic medicines. You're doing extra exercise. You need less insulin then, but you didn't know you were going to exercise and you already took it this morning. And even the stress of like getting sick, like the flu, could change your insulin requirements. So a lot of times this comes on suddenly and it could progress to shock pretty quickly. So the theory is um, that we want to, and how do you treat it? Hypo means low blood sugar. It means that you're going to treat it with sugar because we've got too much insulin taking all the sugar out of the blood, and the blood in the brain always needs some insulin. So the blood always needs sugar because the brain doesn't need insulin to soak up the sugar, it just needs the sugar in the blood. So what can you do? If someone starts acting goofy, and I'll go through the symptoms, but mostly they start acting different, or they're hungry, or they're shaky, or they're irritable, and they're diabetics, get them some orange juice to drink or hard candies or any quick carbohydrate. So I don't care if it's the worst ones for you, in this case, soda, not diet soda, regular soda with sugar, a spoonful of sugar, peanut butter that has sugar in it, any of those that they could swallow, any kind of juices. Okay, so, and you're going to see, so this is hypoglycemia. And why do people get hypoglycemia that are diabetics? They've taken their medicine and then they've either didn't want to eat, didn't feel like eating, took too much medicine, but it's usually they didn't want to eat. They're exercising more than they expected. And this could drop quickly, right? So all of a sudden someone gets, usually by they just act different. They get a little goofy, they get anxious. This one, anxiety. They may start to sweat, but they get irritable. They get irritable and shaky and I don't feel right and weak and they feel like sitting down, but they're shaky. But anyway, there sometimes the symptoms of hypoglycemia are like hyperglycemia. The rule of thumb is always treat if you're not sure with some sugar, or cookie or some food, something that'll digest fast, and all your junk food will digest fast. Because if it's hyperglycemia, a little sugar won't hurt. They need to get it taken care of with different medicines. However, if it's the low blood sugar, hypoglycemia, a little sugar will bring them back. okay, to where they were, and then have them eat some good food. Okay, we put this in here because diabetics, even though this nutrition, have to take care of their feet really well because they get infected, and we'll do that in chapter 12. Um, they could get a toe amputated because it gets infected and can't get better. Okay, let's go over some of the other diets. One is the low salt, which is also called the low sodium diet. Sodium is salt, and it's prescribed for primarily for high blood pressure, heart disease, and kidney disease. Um, so, low sodium diet for the food choices, avoid adding salt, first of all, and use sparingly if you're cooking. Check labels for sodium content. Canned products often have a lot of salt, so just look. Avoid smoked or processed meats like bacons or your lunch meat. Cured meat is your lunch meat, ham, bacon, and you should look for things that are 140 milligrams of sodium or less a serving. Okay, let's go back over the low fat diet. Okay, sorry, I'm clicking around. Um, Low saturated fats, so limit the saturated fats with limit the meats and the dairies, or I guess get the low fat dairy. Um, and don't eat any trans fats. So hopefully you're looking and don't buy anything with trans fats. And when you eat, but you are allowed to eat the healthy fats, olive oil, avocado oil. Avocados have great flaxseed oil, evening primrose oil, salmon, walnuts have a lot of oil in them. And oh, and salmon, just so you know, the wild one has a lot more of the good oils in it. Okay, let's go on to some cardiac diets. So if someone is a heart patient, they may order them a limited saturated fats diet along with low salt and high fiber. And I think everybody should eat high fiber diets. So why do we eat fiber? So fiber, first of all, it'll make you feel more full. So hopefully you'll eat less if you have a, so we don't overeat, which is another problem in our country. But it prevents constipation, prevents the disease of diverticulosis. It reduces the risk for colon cancer and reduces the risk for heart disease. It improves glucose control in the diabetics, and it helps lower cholesterol, which cholesterol will form, if too much cholesterol, you could form plaques on the inside of your arteries. Okay, so how do you get high fiber? A lot of fruits and vegetables. Probably if we ate what that my plate said, we'd have enough fiber. Whole grains, right? Brown rice instead of white rice, beans and legumes. Kidney beans, navy beans, refried beans, they're all good for you. Okay. Um, where am I? Oh, and then there little be said for non-GMO diet, genetically modified diet. So if you're trying to do that, which they say is good for you, you don't want to eat all the corn. Most of the corn has been modified. The soy has been modified. Canola oil comes from that. So just be careful. There's more literature about GMO diets, but it's probably healthier. Okay, observe. Okay, so now um, we're going to watch somebody eat and really know our clients, right? So we should be observing the client or resident's normal eating habits. Be aware of their likes and dislikes. And if they're in an assisted living and they're not eating, definitely report that to the supervisor because maybe they could come over to them and talk to them and, well, what would you like to, if there's special foods that need to be made. There are special utensils available that are easier to use, um, and report like knives and forks with built up ends so they're easier to hold. And then so report if someone's not eating, that's what poor intake means. Report that to whoever your supervisor is. or agency. Okay, so what are the physical and mental conditions that affect eating habits? People could just be having digestive problems like GERD. Um, medications could make them not want to eat or eat more. Loss of teeth or poorly fitting dentures, and that gets to be a concern as we get older. Reduced sense of taste, that happens with the elderly. Difficulty swallowing, inability to eat without assistance, so you may have to help somebody. And then their emotional status. Are they depressed? Are they happy? Um, So now we're talking about like maybe in an assisted living. We're going to serve food. Hopefully you get dining helps provide that socialization time, right? That's where we get it, the idea of breaking bread with somebody. Encourage residents to eat in the dining room and not in their own room, and that's an assisted living. If residents have to dine in their room, take a few extra minutes and kind of chat with them because something might be going on. Provide assistance as needed, and if they have a plan of care, so this depends where you work, if it's assisted living or a home agency, they may or may not have some kind of plan of care where with the food restrictions on it. Okay, and then assisting completely dependent people. Some people we will have to feed. And just remember, it may be frightening or frustrating to be dependent on others to feed you. Okay, but for anyone that we're going to help assist with eating, we're going to position them. Ooh, this is wrong. Should be 75 degrees. Put, position the client or the resident for comfort and safety, sitting upright, either 75 to 90 degrees. And the head, make sure it's got a pillow or something if it needs. Now, not everyone, people are going to go to the dining room, they could sit fine. Remind the resident to wear dentures, so some people forget their dentures. Assist with washing hands and face if they need it, or remind them, oh, did you get washed up? Be aware of diet restrictions, so don't serve them a cake if they can't have a cake because they're diabetic. Change incontinent clients before serving food, so and even remind people, oh, do you want to use the restroom? Dinner's breakfast. The meal's not coming out for 10 minutes. So those people, and some may need a little assistance to the toilet. And encourage residents to use the adaptive self-feeding equipment. Those are like a spoon, but it's got a built-up end, so they're easy to hold. And there's all different kind, and we'll do that in another chapter. Okay. So what should you do? Wash your hands before and after serving food. Keep your hands away from your face and mouth. Keep your hair out of the food, so tie it back or if they have nets. And ask the resident to tell you their name. If you're serving someone that you don't know, and check the meal card. That's what it's saying. If they have a meal card. So depending, you might be working at home with just one person. Okay, again, to go over this, help for feeding guidelines, help the resident to be in an upright position, 75 to 90 degrees. You're going to wash the hands if they can't wash them, just with a wet towel, washcloth. Place the tray where the person can see it. If you have to feed them, sit beside the person at eye level and carry on a pleasant conversation. Tell the person what foods are on the tray and ask what they would like to eat first. Feed them slowly and offer small amounts from the tip of a half-filled spoon. So you use a spoon and don't fill it all the way up. And sometimes if you have to feed people, by putting it on their tongue and waiting, then they open their mouth more. Make sure the person's mouth is empty before offering next bite of food or sip of water, sip of fluid. But you also could watch their Adam's apple, this notch here, to see if it goes up and down. But actually say, oh, let me see, did you finish eating? And then try to look in their mouth. Offer beverages through the meal, allow time to chew and swallow, and watch for signs of gagging or choking. So you could cough, but if their eyes start to water, That means that they're probably got something stuck. Stop feeding when the resident does not want more. Okay, let me just tell you, if they start coughing, don't give them water. Say, cough hard, cough it out, and actually do that with them because then they'll get that whatever's in there out. If you give them water, it's just going to make it worse. After the meal, remove the tray and realize what they have, observe their intake. Now, depending on where you work, you may or may not have to document it. As a CNA, you always have to. Um, but at least observe it because you do want to notify if people aren't eating enough. Assist with their personal cleanliness, wash their hands, give them a napkin for their face. Maintain an upright position for 30 minutes so that if they sit up for 30 minutes, that's great. If they want to go back, lay down, their head should be up about 30 degrees. So their head has to be up a bit because they don't want them to accidentally burp up and make the food. And the food might go up, but then back down into the lungs. Okay, and so that leaving them up for 30 minutes decreases the chance of aspiration. And aspiration is when food or foreign items go down the trachea, the windpipe, into the lungs. Okay, snacks. So a lot of people don't eat a lot all at once as they get older, so they depend on little snacks in between. Make them healthy snacks. They like soft stuff. Cook up some apples in the microwave. It tastes good. Chop them up small. Always check and make sure that certain snacks are allowed. So usually, and I try not to have the junk food snacks. Okay. Now, I just want you to be aware that if you're working working for an agency in a home and you're there for 4 or more hours, you probably will be expected to help with some meal prep for that client. Okay, so might have to cook the meal, and so you have to think if it's a client you have to feed, ask even the agency, what do they usually like to eat? Do they have the food? The food should be in the house. Um, so you have an idea. Sometimes families may leave soup for them, or so you're just heating things up. Okay, but also the smaller assisted livings, like the 6-bed board and cares, that may be part of your job. All right, at least for breakfast, the smaller meals. Okay. And then the last thing is with the dysphagia, which we talked about last chapter's I'm trying to put myself somewhere, difficulty swallowing. So know that if they're already diagnosed with dysphagia, they have a higher risk of aspirating and choking. So with that person, your book says have them bolt upright, which is true. Sit them up 90 degrees. If you get them in a chair, it's better. And when they're swallowing, have them tilt their head down just a little bit. Okay. If they have dysphagia, you cannot use straws. It's better. You have better control if you pick up a glass and put it to your mouth. Okay. And cut the food into small pieces. Number 4, may need to thicken liquid. So that would be an order, specific order. And thickener, and there's one that's called Thicket, make thin liquid, make, oh, it's not, it makes thin liquid thicker, such as so thin liquids such as apple juice or water thicker, so it's easier to control in your mouth. So it's like kind of pasty. They call it nectar thick. So or honey thick, if you imagine honey going down, it just doesn't run out. And nectar juice is thicker, so it's just easier for them to control in their mouth. And also cut all the foods in small pieces. All right, and the last one is just a reminder for people with dementia and feeding them. And maybe they can eat themselves, but you might have to cue them, and that means to tell them to swallow. Oh, swallow your food, or have another bite. Oh, did you chew everything? Did you chew all that broccoli? How is it? Sometimes just ask them, how is the food? Or do you want more? Oh, is there something still in your mouth? Because they forget to eat and chew. And you may need to get them started with a hand over hand technique. So if this was the patient's hand and this was the caregiver's hand, I put my hand over theirs after I put the utensil in and get the food and bring it to their mouth. Get the food. And once they start, it's really strange, but once they start, then they keep going for a while, and then you could do it again. And I don't mean it's just strange how the mind works. It kind of remembers, like you never forget to ride a bike, and they don't forget to do this once they get started. Okay, that's it for chapter 11, nutrition.